You're listening to the Veterans Impact Show, continuing the mission of service and bringing together our civilian and military communities. Brought to you by Fairway Independent Mortgage and Lone Star Wealth Strategies. Don't worry, retire happy and work with us. Good day. What a great day it is. And matter of fact, it's Pearl Harbor Day. And so that means a lot to us. My dad was the radioman that got the message about Pearl Harbor. You want to know more? Go to my website and look up November 16th. 2015, and he was on jimblight.net, my website. Now, today I have Dr. Stephen Holt, the medical director of Vision 17. He is my co-host because Chuck is out. It's so important that we get this message out today, that I get it right and I get some great help. So Steve has been on with me so many times he could do this show by himself. But joining us, the very beautiful and very, very talented Dr. Drs Subramanian. I didn't get it right, though. I've been doing great. Subramanian, right?
Subramanian.
Okay. Yeah, yes, ma'am. I'm sorry. You're a specialist, though, in Parkinson's disease research with education and clinical care, and you're at the Center of Excellence in Parkinson's Disease at the VA in Greater Los Angeles. You're also clinical professor of neurology at UCLA. We were talking before the show about how you got into it, and Steve asked you that question. How did you get excited, and how did you get into the Parkinson's research that led to what you're doing now?
Yeah, so I've always loved the brain. I am a neurologist because I love the brain first. And, you know, people go to med school and they want to help people and they learn about all the different types of medicines out there and different body parts. And I just love the brain because it, you know, is what it makes each of us individual. And I love to learn about people and understand that aspect. I fell in love with Parkinson's because I felt like it was a disease that allowed me to get to know my patients over many years and support them and help them, not just with motor function, but with a lot of different things that affect their quality of life. And so I trained in the specialty and became subspecialty trained. And I started my training at the VA, actually, many years ago. And our UCLA residency partners with the West Los Angeles VA. So it's been a big part of my training and my, you know, great pleasure to take care of veterans. And I run one of 6 centers of excellence in the country in Parkinson's disease. And I'm based in GLA, but we take care of the Southwest United States and patients living with Parkinson's. And it's a very treatable disorder. I think it's an exciting time to be a Parkinson's doctor, and we finally are kind of open-minded about ways that we can help patients, not just with pills and surgeries, which we've really refined and do help motor function. But I think we have a lot of things in regards to lifestyle choices and things like yoga and mindfulness, which are a passion of mine, to help with these sorts of problems that also affect non-motor issues, mental health issues and things in these populations.
You got a strong interest in integrative medicine. And Dr. Holt, you were asking about this a minute ago. Tell me a little bit about the yoga, the mindfulness, and how that relates to what you're doing.
So I became interested in yoga and mindfulness. I grew up in a household. My mom's a family doctor in Canada. So we had not just, you know, Western medical approaches, but also a little bit of open-mindedness to these Eastern approaches. I myself had gotten interested in yoga after I had a few children and was trying to balance my life as a doctor, a wife, a mom, and leaned on some of these mind-body practices in my own health and wellness. And I became kind of known as the doctor who knew about yoga because I studied this. I ended up doing a pretty intensive 200-hour yoga teacher training to really do a deep dive. I met a mentor of mine who is a veteran, actually, who is also a yoga teacher who developed Parkinson's, and he's had Parkinson's for about 15 years and done extremely well. He's taught me about what's worked for him, and we've been trying to work together to develop a yoga teacher training to help yoga teachers to work with our patients, you know, across the world. And there's been a big interest in this. I've also been interested in meditation, which I learned a lot about actually at the VA. The VA has whole health and is quite open-minded to these approaches, not just pills, but, you know, considering things like mindfulness, meditation, Tai Chi, yoga, acupuncture. We have, pretty strong interest in this at the VA. So I developed a lot of educational skills through working with people at my VA, and just actually did a year-long fellowship at the New York Zen Center last year, working with about 30 other doctors, healthcare providers, doing a deep dive into what some of these contemplative areas, so meditation, yoga, how can those help us as healthcare providers to help our patients and actually ourselves in this, rather stressful time with COVID and the pandemic.
Dr. Holt.
I just want to point out something here. This is a story that we occasionally see in medicine of emerging leaders who are willing to look at new concepts and ideas about how we can deal with medicine. And you get this incredible sense of passion that Dr. Subramanian has for wanting to help and do better, not just treat, not just see the next patient, but actually find ways to really make a difference, improve the lives, the quality, and the outcomes for our patients. And you don't see that a lot, but when you see people who are going to be real leaders, who are real leaders, because she's at a center of excellence, this is a common theme you see. And I just, your enthusiasm and your way of looking at so many different things is just incredible. I'll stop there.
No, I think it's important in mind and body, because if you listen to any of the teachers coming out, it's whether it's biblical or it Hindu Vedas or just whatever, you're going to find this connection between mind and body, without a doubt. And I think that's really important. And I'm amazed when you said they're teaching yoga and they're using acupuncture in the VA. Dr. Holt, did you see that when you guys were working with it?
Oh, yes. My former place was one of the leaders at facility level for implementing those whole health modalities of yoga, acupuncture, acupressure. We had over 50 nurses trained in what's called battlefield acupuncture. We had more than, anybody else because our nursing really was interested. But yeah, we've adopted, the VA has that opportunity because we're a not-for-profit to adopt these modalities which don't generate a lot of revenues, unlike what commercial medicine has to do, because they have to make money to stay open. So we were able to lead the way in adopting, studying, implementing, and figuring out how to make these things work the best, which is what Dr. Subramanian is doing and leading that way.
I think of Parkinson's in terms of the shaking, like the actor Michael, I can't think of his last name, who
Michael J. Fox.
Yes, thank you. I knew there was a reason I needed you today. that we see that, and can then yoga begin to calm the mind, that the mind can begin to control the body and reduce some of this?
Yeah, so yoga is a very interesting area, I think, of practice. So it falls under this umbrella of the, Ayurveda, which is a sort of school or a field, sort of an approach to medicine that is, thousands of years old, that started in India. Yoga is, one aspect of that, and it has three very interesting components. So one component are the poses, the postures that you can put yourself in. And, people always think, well, I need to be super flexible, like a ballerina, and, do all these contortions. And, I can't even get off a chair. How am I going to do this? But actually, there's ways to modify many of these poses and get some of the benefits, which are quite striking, actually. You can do things in Parkinson's disease. We have stiffness and slowness. And patients, sometimes get bent posture, sometimes their hips get tight, their neck pulls forward. So the poses themselves are actually quite beneficial from a physical, stretching and this sort of perspective. We're also able to challenge the balance centers with some of the poses. So we have those poses. Then we have this breath work that we incorporate with the poses. And the breath work is actually very, very powerful. It actually taps into the autonomic nervous system, which is this background nervous system, which affects heart rate and respiratory rate, blood pressure. It's really that fight and flight kind of response. So the sympathetic and parasympathetic nervous system. And you can actually modulate that very powerfully with breath. So the breathing is actually very, very interesting. And that is an area that is also abnormal in Parkinson's patients, the autonomic nervous system. So that's something that's powerful. And then the third area is this meditation. So this sort of thoughts about, can we focus the mind? Can we quiet the mind? Can we bring sort of our focus internally? And that is actually very powerful for things like cognition. So when we're having issues with memory, things like that, sleep can be affected, anxiety, depression, all of these things have been shown to be benefited by the meditative aspect. So yoga actually has all three of these combined. So I think it's a very powerful practice.
And I'm just going to pipe in and say, the breathing in particular, we know the special forces have used this quite a bit to overcome the body's quick reactions to things so that they can be calm, take in everything that's going on, and quickly formulate the right response, overcoming the body's reactions, which are distracting. So, we see this used by our veterans in very intense and dangerous situations. They train to do this so that they can stay focused and not have their body override their mind's attempt to analyze and react to what's going on around them.
Well, Steve, you're a flight surgeon, and and I'm a pilot. I know that when you get in super stressful situations, a lot of times what happens is you quit breathing. You consciously are not breathing. You're so tense, and that doesn't do you any favors to get through that situation. But also, one of the things that I think about is I studied with an Eastern teacher from India, from New Delhi. And so we were in great classes, and there was a lot of social interaction as a result of being part of that group. And there I was, 60 some odd year old guy in with a bunch of 20-year-olds. And it was a little bit hilarious because everybody said, well, gee, what's that bear doing in there? But the main thing is it's the social interaction. And this goes back to one of the things that you and I and Prince Taylor talked about is isolation, loneliness. You guys call it loneliness, and I term it as isolation. I see it as a CSA. It is a critical path to bad health if you start isolating. You get lonely. And so one of the things is you're bringing this into an integrative medicine situation to also try and get people out of isolation. Can you explain that a little bit better?
Sure. So we look at that whole health kind of wheel of things that are offerings to try to help our patients be guided into these lifestyle choices. Social connection is a big part of that. And I think that we as clinicians, as doctors, have really probably not studied this very much and have really I did not know much about the effects of loneliness until I really started doing some of this work. And I think our current Surgeon General, Vivek Murthy, had written a beautiful book called Together, where he talks about and brings real life stories about his own sort of high school days when he was sitting alone at the lunch table and what that sort of did to him and how important it is to be socially connected. You're absolutely right that some of these Eastern approaches and even, Western approaches with contemplative spaces, prayer, getting together, with religious traditions, the rituals that we come together and do around the holidays. Many of these things involve, family and friends and connection, right? So, and even when people are meditating together, doing yoga together, breathing, they're usually doing it together in these spaces. So that sort of shared human connection is so exciting.
I think this is really important. So I'm asking everybody to share this on YouTube, share it on Facebook, get it out there. We're talking about integrated health. We're talking about having healthy minds, healthy bodies. Again, my co-host today, Dr. Stephen Holt, Colonel, retired U.S. Air Force flight surgeon, the former director of the North Texas VA healthcare system, one of the most knowledgeable men that I know, and I asked him to join me today so that we can do a really great job and we can help Dr. Subramanian to be able to get the word out about not only Parkinson's, but isolation. So we're going to give you some more information when we come back from the breaks, and we're going to talk about where you can go to find out about all this. This is the Veterans Impact Show. Stay with us. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. This is a great day. This is Pearl Harbor Day, and it's not about the disaster there, but it's about stopping the disaster that comes from poor health, mind and body integration. That's what we're talking about. I've got Steve Holt as my co-host, tremendously knowledgeable doctor, Air Force flight surgeon, and also Dr. Drs Subramanian. Did I get it right that time? Yes. Okay. I'm sorry. I sometimes have problems with that. But it's very important that what we're talking about is isolation, loneliness, and Parkinson's disease. And Dr. Subramanian is the director to the Southwest Parkinson's Disease and Research and Education Clinical Care at the Center of Excellence in Parkinson's Disease in the greater Los Angeles area. We've talked about her passion, which is amazing. I got to tell you, if I was in Los Angeles and I had a medical problem, I'd go see somebody like her who is so passionate. And thank you for being on board. Let's talk about, though, isolation, because many times people with Parkinson's, like you were talking about, Michael J. Fox, Steve, that you brought up, they begin to isolate. They begin to withdraw because they're shaking. They can't go into a restaurant and pick up a coffee cup or a glass or a fork. And these things, I think, further and make things worse. So, Dr. Subramanian, let's talk about, with isolation, how that is affected by Parkinson's, and cover some of these dimensions of loneliness or isolation.
Sure. So we use the term social isolation, and that's something that we can actually measure. So I can see, how many people you live with, who you talk to, how many phone calls you make, things like that. Loneliness is this more of a subjective feeling. It's really this sort of gap between the relationships that we have and the relationships that we desire. So it's really sort of this felt sense that I feel like I want something that I don't have. And so it's that sort of lonely, sort of subjective feeling. And we can measure that with scales like the UCal loneliness questionnaire and things like that. So I didn't realize that loneliness affects health in general. It's as bad for you to be lonely as, it's actually worse for you than smoking 5 cigarettes a day or being obese in terms of outcomes with mortality and other, disease processes. In veterans, it affects risk of depression, anxiety, substance abuse, and actually suicide in our veterans. In general, loneliness can affect a lot of things. And in our research in Parkinson's disease, and this was actually pre-pandemic research, it was as bad for you to be lonely as the beneficial effects of exercising 7 days a week for 30 minutes a day was good for you. And that's, exercise is medicine. That's like the one thing that I can prescribe a person with Parkinson's to really benefit them. And so loneliness is as bad for you as that aggressive exercise on a daily basis. So it's really a pretty profound risk, and it really is something that I think we can do something about. So it's not just doom and gloom. We really are trying to find proactive ways to connect people. In the research, we also found that, it's not enough for you to have one sphere of connection corrected. So there's 3 spheres of connection. I found this very interesting. One is this intimate sphere where you have somebody who loves you at home, the intimate connection of a wife, for example. That's something that's important for all of us. But there's a second sphere where it's a relational sphere where you have some friends that are outside your home that you can talk about your problem to. And then there's a societal kind of connection where we have some connection with a group in our community that has some sort of shared sense of purpose or meaning. And for some of our veterans, it's actually being part of a veterans organization, a Parkinson's patient that might be being part of a Parkinson support group. So you actually need connection in each of these three spheres to not feel lonely. And so when we see people in our offices who come in with a loved one who seems to be very connected and happily married with them, we think, okay, well, this person can't be lonely. But in fact, the couple can actually be lonely together. And it's important to find ways for them both and each to connect outside the home with these other spheres. So that's something that I think is quite important to realize. And so what we've tried to do is really think about intentional ways where we can proactively find people who may be lonely by screening, and then try to do something that's actually quite novel and exciting called social prescribing, where I, as a doctor, Dr. Holt, as a doctor, can say, you know, I'm worried about you because I realize that this is something that can affect your health. Let's try to connect you with a prescription to try to get you to socially connect with resources in your community. And, you know, this is sort of a novel way of prescribing medicine that is not just pills.
I think that's really great. So when we come back from the break, we're going to be talking about the Compassionate Contact Corps that you and Prince Taylor have put together, which, as I understand it, is the largest volunteer organization within the federal government. This is a great thing. Matter of fact, I was in a meeting yesterday, and this lady was talking about her dad in McKinney needing help, and I said, I'm going to connect you with a Compassionate Contact Corps, and she was just thrilled. So this is a tool that we can use. So we're going to be right back. This is Veterans Impact. Join us. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Joining me today, my co-host, Dr. Stephen Holt. Absolutely fantastic Air Force. I don't care. I'm Navy aviation. He's Air Force flight surgeon. I mean, you know, by the way, neither one of us made it into the bowl game, I think. Or did I don't know. We'll see. No, wait a minute. Air Force is playing Baylor, isn't it? I think that's it in the Armed Forces.
I'm
bowl.
not sure.
All right, let's go on.
I'm reluctant to say I haven't followed it.
Okay, what we're talking about is the Compassionate Corps, the Compassionate Contact Corps. How do people find out about that, Dr. Subramanian?
Yeah, so just to clarify, so I'm just a neurologist in the community here in Los Angeles. And I really, you know, my research has been in integrative medicine and the effects of loneliness on Parkinson's patients and other things about how we can really, you know, proactively help patients find ways to sort of prevent progression of their disease or live better with their disease. You know, Parkinson's is a chronic, lifelong sort of problem that we have to help our patients to live better with. And so I'm all about being proactive and helping people to find things that they love, to connect them and help them to be the agent of their own sort of destiny, in so to speak. And people do better when they have choices and they can be part of their medical care. So as part of that, I had, you know, in the pandemic, we were quite worried. We had this data going into the pandemic about how bad it was to be lonely as a Parkinson's patient. And then we were making people socially distance and shelter in place. And a lot of our patients were calling up wondering what they could do, since they knew that they felt good when they got together in groups, when they were doing exercises and yoga and things like that, which we had on offer at our VA. So I started this virtual support group literally on day one of the pandemic. And we started making sort of connections in the community and calling patients up and having them join our Zoom calls. And we really grew this movement throughout the world, actually. I interviewed a bunch of people who were leaders, thought leaders in our field, including people like yoga teachers and psychologists and psychiatrists and all kinds of dance teachers, anyone who knew about Parkinson's. We've done about 120 of those interviews. And we realized that, you know, developing ways to connect people in community was really key. I had learned about the Compassionate Contact Corps, which is the program that the VA Volunteer Service had started. They had a number of volunteers that were coming into the VA. As anyone who comes into the VA knows, we have such a robust group of amazing volunteers that are often in our lobbies, that greet you and are very, you know, lovely and connect with each other. And they just loved coming in. So we suddenly had these quiet, you know, hospitals, and we were seeing patients in clinic by ourselves, sometimes on telemedicine. And we realized that these volunteers weren't coming in. What were they doing? Well, so Prince's team on a national level, redeployed these volunteers, realized that being a volunteer is actually very beneficial, and we didn't want to lose out on helping those volunteers to get the benefits of volunteerism. We also had a population of veterans that were isolating and at increased risk of being lonely. And so they redeployed these volunteers to proactively call on patients weekly, either through the phone or through some video modalities. And that program's been going on for about, I think about a year and a half now. So I've just sort of been involved in referring some patients and really helping to spread the word about how I think it's really a cool, novel approach, fits into this umbrella of social prescribing that I think is very exciting as a way to deliver healthcare, in a novel way. And the place that probably does this the best in the world is actually the UK. So the National Health Service had written about their own programs in the New England Journal of Medicine. And I sent this paper to Prince and his team, and we really started just giving talks to whoever would listen about the importance of loneliness, about this cool program that we have at the VA. And we pitched it to a New York Times writer. I did a TED Talk on it. So really just trying to get the word out about how important this is.
You can go to www.volunteer.va.gov to find out more information about the Compassion Contact Corps. This is important. If you want to volunteer to be a mentor, you can do that. They've got a training program, correct, Dr. Subramanian? So, and yeah. Steve, are you familiar with this? Have you seen this program?
I've not seen this, but I will comment that the volunteers that come to the VA make an incredible contribution, tens of thousands of man hours, and they are just incredible. I can never express my appreciation enough for volunteers at any level of activity. And if you're looking for something to do, you're bored at home, consider volunteering at a VA.
Absolutely. So again, www.volunteer.va.gov. You can go find out about, again, the Compassionate Contact Corps. I'm trying to read this. Diane's putting it on the Facebook so you can see it. It's really important. And they've got a great solution to many of the problems. Now, I can understand this and relate because of my work as a certified senior advisor. I see it all the time. I see the negative health repercussions of isolation, of ending up using cigarettes or alcohol or food or 32-ounce Big Gulp full of sugary Dr. Pepper will do the same thing in really creating health problems where if you had social interaction, where if you weren't isolating, I think, I had lunch with a friend of mine yesterday, and he goes, wow, you've lost a bunch of weight. You must work out a lot. And I go, yes, I do. My wife and I do. He said, I need to do that. And I said, yes, you do. And I think it's important when we do that. So again, and when I look at what your Compassionate Contact Corps, their vision, they're going to engage veterans. Now, here's an interesting thing. Dr. Holt, when you and I first got started broadcasting, you are the one that told me 70% of the doctors in the United States or medical professionals train in the VA. Dr. Subramanian, you did too, from what you said, correct? So yep. This that we're doing may be for veterans and for the military, but it's going to mushroom and move throughout our entire populace and help those seniors who need help. And there's a lot of that going on, as well as people who are divorced or people who are isolated or people with Parkinson's or people with other diseases tend to isolate, and this would help. And I got to tell you, why they say their goal is to reduce veteran isolation, loneliness, I'm going to say nationally across the board, I think we need to be doing that across the board. I think this would also maybe begin to help some of the problems with bullying that we see, whether it's in school or in the community. I don't know if you guys agree or not, but I see a lot of it.
I totally agree, and I think we've seen such an escalation of this with COVID and our processes. I lost a tremendous number of my volunteers because of COVID weren't coming in because of the restrictions, and the risk and fear. And it spans all age groups. And again, as Dr. Subramanian has pointed out, social connection is just a vital part. We are a social animal. It is part of our makeup, and it is such an important part of the quality of life. And without a quality of life, that has a very negative impact on long-term health. So, and I think she's made that point over and over in what she's saying.
Yeah, isn't it great to talk with somebody with this much passion? I got to tell you.
Well, I've got to tell you, you don't become a director of a VA National Center of Excellence if you're not a superb clinician, passionate, and able to also orchestrate, run, and affect a significant amount of the healthcare system. And so, you know, she was humble when she said, I'm just a neurologist. No, don't believe that. She is one of those top 1% superb leaders who is running one of our very important centers of excellence in the VA.
Well, this is tremendously important and powerful and essential to our, to our communities, but it's very relevant too. And as I said, I see that as a certified senior advisor all the time. I never saw that with my dad, but I see it with my mother-in-law. And my wife is sitting here shaking her head saying, yes, we see that. And we saw that with Diane's father. I saw that with my stepmother. I even saw that with my own mother when she had cancer. And I mean, life just shriveled up. And the isolation was just terrible, as well as the repercussions of what they had.
This is well recognized. And I mean, look at how we treated POWs. Look how political prisoners were treated in the former Soviet Union. They were isolated. They weren't allowed to work or interact with other prisoners. It's well recognized, not necessarily in a scientific study, but it's certainly a political behavioral, that it has tremendously negative impact, and it's been used very effectively in those settings.
Steve, one of my closest friends is Dave Carey, who was one of my pilots in Vietnam, and he went down August 31st in 67, and he was there 5.5 years. And he wrote a great book, The Ways We Choose, and he talks about what the prisoners did to not be isolated, how they developed a communication system, and what they did. And Dr. Subramanian, I'll send you Dave Carey's book, and I'll introduce you, because that's a guy you need to know. He is the real life story of what you're talking about in 5.5 years in Hanoi Hilton. What was also similar when you're thinking about it, those guys not only were isolated, but they wouldn't let themselves stay isolated, but they were terrified, they were brutalized, they were tortured, and then they were constantly told, you're dead, you're never going home. Well, think about this. Someone who has terminal cancer, someone who has Parkinson's, like Michael J. Fox, all they can think about is the terminality of the disease they've got, not about overcoming the disease.
Yeah, and that's the message that's coming through from Dr. Subramanian. There are so many things that the patient can do to affect their health. And you know, veterans in particular are fighters. You know, we were trained to do it. That's what we do and she's giving them the opportunity to have fighting techniques that enable them to affect the outcome of their disease, and to it may be small victories here and there, but to affect it and take control in ways that and it's very important to take control. I'll stop there.
Well, Dr. Subramanian,
I will say.
Oh, go ahead. I'm sorry. Please go ahead.
No, I was just going to say I think what has been very clear is the effects of isolation on mental health in general, not just of our veterans, but even of the workforce of us clinicians. When we haven't been able to get hugs or see each other smile or come together in groups, it really made us feel kind of unsettled. And I think, what that unsettling is really that sort of sense of feeling that lack of connection, which is like was just said is a basic human need. And I think, many of the times some of our men in society are told that they are strong and that they don't need other people, that it's okay to sort of, just internalize their feelings and not talk about them. And that ends up being kind of a real setup for mental health issues that can then drive further isolation and bad thoughts and negative outcomes. And I think that really sort of unwinding that negative downward cycle and sort of normalizing these conversations about how all of us feel lonely at times. It's such a high statistic. It was before the pandemic, it was upwards of 40-50% in aging populations. It's probably closer to 70% now of people that feel isolated or left out at times. And, it's such a normal human emotion and to feel alone and to feel disconnected and to feel then bad. And then it sometimes leads us to feel unliked, or that there's a stigma of being alone, and that there's a stigma with mental health, and then people isolate more. And so I think the message is really just the universality of how everyone feels this way, how common it is, how it's important to proactively ask people how they're doing, and if they do feel, isolated, to really bring them out of that sort of, hole. And we see veterans every day these days that are coming out finally from the pandemic, and we see them, we ask them how they're doing, who they're connecting with, and really they haven't connected with anyone in sometimes months. And so part of the prescription is really to give them, sort of a task of, let's think about the Christmas card list that we're going to send cards to, or whatever. Let's try to see if we can call somebody on that list instead of just sending a card. Let's see if we can knock on, your neighbor's door and see how they're doing. And sometimes veterans will come back to me. I saw a patient the other day who I had tasked with this, and he, said, I knocked on the guy's door and I had no idea that he was sitting there for 3 months having not talked to anyone, and it made his day.
Oh,
and now we
man.
go around and knock on other people's doors. So it's, sometimes infectious.
Without a doubt, without a doubt. All right, we're going to take a break for just a second to hear from our partners, but we're going to be back to wrap up in talking with Dr. Drs Subramanian. She's an amazing, amazing doctor in Los Angeles with UCLA, Parkinson's with the VA Center of Excellence, and my co-host today, Dr. Steve Holt, great man, retired colonel in U.S. Air Force, flight surgeon, former head of North Texas VA, now the head of the medical for the whole state of Texas. And so I've offered to help him get the word out, and this is one of the first. We're here for you. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, I'm about to bring this program back into the dock, as any good sailor should. So one of the things I want to ask Dr. Subramanian about, you focus on Parkinson's. We know a lot by seeing Michael J. Fox, but is this disease reversible to any degree? I know there's research being done on that. I would think that some of what you're doing with yoga could help. Are there medications? Are there things that can be done to help that?
Yeah, so Parkinson's is a very common disorder. It has doubled in the last 40 years, slated to double in the next 20 years. We're not too sure exactly why that is, but we're seeing this in lots of people that even look like me. So one of the messages is that it's not just an old man's disease, which is what it's been branded as. It's not just in Caucasian men, it's in women, younger people, people of color, all kinds of people worldwide. So this is a common problem. We're seeing more of it. We're not 100% sure what exactly causes it. There's a genetic predisposition, some environmental toxins. In the VA system, we have a service connection with Agent Orange and Camp Lejeune. And so, we urge our veterans to think about this and understand that anyone really of many ages can get it. And so people are having symptoms, stiffness, slowness, tremor. But there's also a host of non-motor issues, things like anxiety, depression, sometimes cognition, constipation, changes in sense of smell, changes in sleep architecture. There's many, many ways that one can sort of look and see if somebody may have this or a predisposition to this. And it's very treatable. So we don't have a cure, but we have medications that can help the motor symptoms especially. So we have ways to replace a chemical that's missing in a patient's brain that replaces dopamine. We also have cutting edge surgeries, amazing surgeons in the VA system. We've done some of the pivotal studies in this disease state actually that are out there. So we also have amazing mental health providers that know about this space as well, psychiatrists, psychologists that are doing cutting edge research actually in this field as well. And so we're quite well poised to take care of veterans, and we're here to serve our veterans. And so urge people to look up the PADREC, PADRECC website and get care, get connected to a center of excellence or to neurologists throughout the VA. So we have a lot of resources. And so I think, things are hopeful. We don't have a cure right now. The things that may change the course of the disease include exercise. And we're hoping to do more studies and really show that things like keeping people socially connected, meditation, yoga, these sorts of things are some small studies that are having mounting evidence that many of these things may be beneficial, a Mediterranean diet, things like that. So we have, these sorts of lifestyle choices, and we urge people to get, connected with resources. We work pretty closely with people like the Parkinson Foundation and other support groups throughout the country to get vetted information in the hands of our veterans. So, so I think we are hopeful that we will see progress in teaching people how to live better. And a lot of what I do is really wear these different hats and bring, people together to really have conversations, including patient voices, which I think are really important to show what matters to patients, what affects their quality of life, and how to make that, translate into what we do for veterans every day in our centers of excellence.
One of the things I want to tell people is if you are a veteran and you qualify for VA healthcare benefits, Dr. Holt and I and Dr. Subramanian can tell you there are VA accredited reps in your community. They may be through the American Legion. They may be through VFW. They may be through the state of Texas here, where we have VA accredited reps that do not charge. It's done for free, that can navigate this system, can help you with the paperwork. I have helped so many people get aid and attendance pensions, get hearing aids, get into the VA, and it's important because the VA is a great place. Everybody makes mistakes. You've heard some bad things. Don't believe it. The VA has changed, right, Dr. Holt?
Right. And there are multiple studies that show that.
All right. We're going to close with a prayer. I want to say, dear God, thank you for men and women like Dr. Holt and Dr. Subramanian and all of our veterans. Protect them, take care of them, and please protect our active duty military, our first responders around the world who are working to take care of us and keep us safe. In your holy name we pray, amen. Again, Dr. Subramanian, thank you so much for being on board with me. What a great day. And Steve, man, I need your help a little more often when it gets to this. So thank you. This is the Veterans Impact Show. Join us on Facebook. Subscribe to us on YouTube. Let everybody know. Send this word out. This is an important program that we are here to help veterans and our civilian community as well. I'm Jim Blythe. Again, look me up on jimblythe.net. I want to help. Give me a chance. Give us a call. We're here for you.